Assalamualaikum. Today we'll do the spotting of posterior thigh and popliteal fossa. Here is the specimen of lower limb. First of all, we'll do the side determination. As this is the big toe, so this would be the medial side and this would be the lateral side. Talking about muscles of the posterior compartment, which are also termed as hamstring muscles. As you already know, hamstring includes long head of biceps, semitendinosus and semimembranosus muscles. This is ischial tuberosity. All the hamstring muscles get their origin from the ischial tuberosity. This is the medial side of the lower limb. This is semitendinosus muscle. Semitendinosus, it has long tendon as you can see here and is inserted onto the medial side of upper end of tibia along with the gracilis muscle. This is the gracilis muscle, sartorius, gracilis and semitendinosus. These three muscles are forming the pes inserinus on the medial side of upper end of tibia. Just beneath the semitendinosus you have semimembranosus muscle, the bulky thick one. This thick one is the semimembranosus, which is inserted onto the posterior surface of upper end of tibia, groove on the posterior surface of upper end of tibia. Semitendinosus, semimembranosus. Now we have the long head of biceps femoris. This is origin of long head of biceps femoris from the ischial tuberosity, and this here is the short head of bicep originating from the linea aspera of femur. The biceps femoris then gets inserted onto the lateral head of fibula on the lateral side, this one. These three were the hamstring muscles. Now talking about the nerve of posterior compartment, which is the sciatic nerve. Talking about its origin, it arises from the lumbosacral plexus midway between the ischial tuberosity and greater trochanter. This is greater trochanter, this one is ischial tuberosity. It passes midway between these two landmarks in the posterior thigh deep to the biceps femoris muscle. In the popliteal fossa, it divides into two divisions. This medial division is the tibial nerve, which supplies the posterior compartment of the leg. As you can see here, this is the deep nerve of posterior leg. The lateral division of sciatic nerve is the common fibular nerve, which encircles the neck of fibula on the lateral side. This one is the common fibular nerve, the lateral division. Now let's talk about, as you can see here, the common peroneal nerve. It travels along the medial margin of the biceps femoris, then it encircles the neck of fibula here and supplies the medial and anterior compartment of legs.